we will begin today's webinar, Understanding Cancer-Related Fatigue. My name is Madison McMahon Ward. I am the Program Coordinator for Triage Cancer. And it's my pleasure to introduce you to our speakers, Lisa Marie Juden and Amy Rosenblum. Lisa Marie Juden is the Provider Advocacy and Research Manager at Tired of Cancer. As both a registered nurse and then nurse practitioner, she has specialized in medical and surgical gynecologic oncology over the past 10 years. She began her nursing career at Massachusetts General Hospital prior to her transition to the Dana-Farber Cancer Institute in Boston. After moving to Amsterdam, she is now able to bring her clinical oncology expertise and nurse leadership experience to help the fight against chronic cancer fatigue with Tired of Cancer. Our other speaker, Amy Rosenblum, is the Director of Global Partnerships, focused on generating awareness of cancer-related fatigue across the US, UK, and EU, while sharing UnTired's cancer support program with patients and care providers. Her responsibilities include providing education for CRF in the cancer community while creating sustainable global partnerships with key healthcare stakeholders. Remember, if you have questions for Amy or Lisa, please type them in the Q&A box, and Amy and Lisa will be happy to answer them. So with that, I'd like to turn it over to our speakers.
Great.
So Amy, you now have control.
Perfect. Thank you so much, Madison. We really appreciate the opportunity to speak to everyone today about the very important topic of cancer-related fatigue. And I am going to hopefully just be able to click through and get the, oh, there we go. To talk to you a little bit more today about understanding cancer-related fatigue. We have a little bit of the delay, but for the next, I would say 45 minutes or so, we're going to really dive into the problem. What is cancer-related fatigue? What causes it? What to look for? And most importantly, the interventions that are available to better manage through it. And as part of that discussion, we also want to share an energy measurement exercise with you that could be valuable to your patients or you as an individual or as a provider. And then, of course, we do want to leave time to address questions at the end. But to Madison's point, as we're going through the topics and having the conversation around CRF, please feel free to pose a question. We're happy to answer it, especially as it relates to any specific slide that we're going through. So to get started, let's focus on the problem that we're all here to learn a little bit more about, and that's cancer-related fatigue. Looks like we're just a little bit of a delay here on the slides. See.
There we go.
There we go. Oh, so we will just step back. So cancer and its treatments lead to many side effects. More visibly, you see the nausea, hair loss, pain, cognitive impairments, diarrhea. Those are some of the very common side effects that individuals hear about first and foremost. But the most common is cancer-related fatigue, and it's something that not everyone typically hears as they're going through treatment or post-treatment. And that's really what we want to discuss with all of you today, to get more insight into what CRF is, how you could better manage it, and some of the additional, as I mentioned, interventions that can support you through it. Now, Lisa, as a provider, with CRF being the most common side effect, why is it that we don't really hear as much about it?
I think the issue is that there's so much of cancer and its treatments that can cause fatigue. And there's so much as a provider that we want to be able to treat this fatigue. So, we're looking at blood counts, we're looking at the type of drug, we're looking at additional hydration appointments, more hydration, etc. But at the end of the day, even with all of that, that doesn't really cure this core cancer-related fatigue. And as living in a busy world, especially in a 2020 world, it's very hard to sit down and nail this down. So I think that's the issue. One is to validate patients that their cancer-related fatigue is real, even with all the supportive treatment available. And two, what do we do about it? And I think that's the major issue.
Absolutely. So I think to really, eh, in getting started, understanding the definition, I think is probably the first place to start. So I want to share what the National Comprehensive Cancer Network has as far as the formal definition, because I think it really helps kind of give us that foundation. So CRF, and I'll read it here on the slide, is a distressing, persistent, subjective sense of tiredness or exhaustion related to cancer treatment that is not proportional to recent activity and interferes with the usual functioning. And I, we have a couple words highlighted, and I think really subjective is one to be focusing on, because it's different for every individual, and there isn't, say, a blood test or a scan that can confirm fatigue exists. And I think that's also one of the challenges that we, in being able to address it, in that it's not easy, and it's up to every individual to bring it up. So I think beyond the definition, though, other things to look for, especially as an individual who may be suffering from cancer-related fatigue, or as a provider who may be talking to your patients, I want to highlight the characteristics of it, because I think cancer-related fatigue is not just being tired or exhausted. It's not something that can easily go away with a nap or a cup of coffee. And so really being able to define and differentiate what it is. So first, it comes on suddenly without warning, and usually not as a result of a specific activity. It's an extreme experience, and it seems like exhaustion, and the recovery time lasts longer than what a normal fatigue, where you could take a nap and feel refreshed. It's not always the case that way. There's a lot of different ways individuals have classified it. We've heard some individuals say it's almost like feeling like you're unplugged suddenly, or that your battery has been completely drained, almost going from 60 miles an hour to zero, stopping immediately. Those are some of the ways it's been defined. So as an individual, and something we always want to ask from a patient perspective, what characteristics you may be experiencing that may be similar to this. Or Lisa, as a provider, what have you typically seen with your patients as far as characteristics of cancer-related fatigue? What have they shared with you?
So, with CRF, I feel like it's something that's always there, and it's the symptom that lingers, meaning that, of course, when you're in treatment, we're as a provider, we're trying to keep you in balance as much as possible. We're trying to keep the patient, optimal at all times. So it's blood counts, whether it's, like I said, hydration, blood transfusions, changing dosing, individualizing care. But the cancer-related fatigue is always underlying, and it's always there, if that makes sense. And oftentimes, when I mean it's the symptom that lingers, it's that when you're done with treatment, or when you're taking a break with treatment, why are you unable to do the things that you weren't able to, like, that you were used to be able to do when you weren't on treatment? And it's that effect, it's that feeling, and it's sort of that validation of a symptom. It's the symptom that lingers on and on and on, and it's very real, and it needs to be addressed, basically. And I think oftentimes as providers, or even as patients, or even as family caregivers, we blame treatment, we blame the cancer, et cetera. But at the end of the day, we really need to focus on what we can do about this, because we can. we can do something.
That's so true. Absolutely. And one of the, key points that I know we keep bringing up, but it very much is different for every individual, and it is subjective. And this impact slide is one that I like to highlight because it just shows that every individual has their own way of describing their fatigue and the impact it has on them. And so this is just a word cloud of what we've heard from individuals as they've shared their own personal experience with cancer related fatigue. And I know we have the chat box. So if you are a patient and you don't see a word that maybe you personally would describe, do share it, because this is, like I said, it is something that's ever evolving. And to Lisa's point, it's all about being able to, acknowledge it and then move forward and really being able to do something about it. But want to make sure that we capture really all the different ways it can be described, because it is different for every person. But we see here, the bigger words that are bolded: the debilitating, life altering, overwhelming, drained, some of those really big kind of ways to describe it, and how individuals try to describe it to those around them as well. Because one of the things we hear the most is that unless you're in that person's shoes, you truly don't understand. It is really hard for someone else who hasn't experienced cancer related fatigue to understand it.
Mhm. And just to second that, just a few things because I'm passionate about it, but it's definitely true. I want to second that what Amy said. As I've been a family caregiver, my mom had ovarian cancer, my dad had pancreatic cancer, my sister had neuroblastoma, and I'm a gynecologic oncology nurse practitioner. So one of the most wise things that my mom told me as when I was becoming a provider was to, at the end of the day, no matter how many patients I see, that I will never truly understand their experience. And so I just want everyone here to know that the patient's experience is real, and that's half the battle. And just to add for the questions, I see just a question from Paul. How do I tell if my fatigue is associated with my cancer or simply with aging? And the way I would describe that to people is that, you could have a 25-year-old, equal education, equal life. One just ran a marathon, one did not. So if that gives like any sort of kind of analogy. So you're running the marathon on top of everyday life. And then I also just wanted to share Kelly and Denise. So other words are frightening, anxiety, and definitely, I was going to say, one of the common things that I often see in my practice, or I did see in my practice, was this whole theory of chemo brain. Oftentimes, there's mixed research on the internet. Is it a real thing? Is it a fake thing? It's definitely a real thing. It's fatigue. It's cancer-related fatigue, and that's the issue. So I just wanted to make sure that you all know that.
Yes, and I apologize. I think we're having the slides are going forward and not backward. So I wanted to highlight really the impact slide. So Madison, I'm not sure if you can pull back to the nope, the impact slide right before we got to the word cloud. Or I think we just have a bit of a delay. That the impact of cancer related fatigue, and that it's physical in terms of limitations. So you may not be able to go, at least you just mentioned running a marathon, you may not be able to do the same physical activities that you once were. But then there's also a social element. So social invalidation, not being able to go to work or interact with friends and family in the same way that you did previously, or taking on a completely different role in the family. I know we hear a lot from individuals as far as having to kind of step back and not be able to, really be as much of a primary caregiver in the family, especially going through cancer with a family with children, especially, and needing to lean on others. Truly, it taking a village in terms of support. And then there's the psychological problems. So not being able to say go out with friends or to have that same kind of quality of life that you were used to can lead to depression and anxiety and poor sleep. And we'll talk about this in a few minutes with regards to the vicious circle. But all of these areas are impacted with regards to cancer related fatigue. So, as individuals have kind of said in the chat, kind of feeling numb or not feeling or feeling dumb. There's so many various areas of one's life that can be impacted. Lisa, did you want to comment at all about this?
No, definitely. And we'll move on to the vicious circle, but that's the thing. I think where it stands is that it starts at diagnosis, and then you go through treatment, whether that be surgery or chemotherapy or radiation. And those things are always the excuse for this. And that's the thing. And I think that it doesn't allow, by making treatment an excuse, it doesn't allow you to validate and help kind of yourself and acknowledge this reality of being exhausted from what's going on. And it just kind of spirals out of control, so to speak.
Now, and hopefully I don't have a problem moving to the next slide, but I want to talk a little bit about fatigue score, because as we've been saying, there isn't a blood test to confirm that you have CRF or a scan. It's not something that can be measured objectively because it is so subjective. But one of the ways that fatigue is being captured and measured is through the 0 to 10 fatigue score. And when we talk about individuals dealing with fatigue, and really that means individuals that are experiencing moderate to severe fatigue. So when you look at that score in front of you, that's anywhere from 4 to 10. And so as someone who may be experiencing fatigue, step back and ask yourself, on that 0 to 10 score, where are you today with regards to fatigue? And also, if you think back to, maybe when you first realized that fatigue was an issue, what was that score then? Obviously, every day can be different too. But it's important to note that especially the first year after diagnosis is when fatigue is the most prevalent. So typically we say it's about 80% of all individuals will experience it. And then what's surprising to a lot of people is, and Lisa, I definitely want you to touch on this, is that there is long-term fatigue, and that it's roughly 35 to 40% of individuals experience fatigue even after treatment has ended. And that can be a surprise to a lot of people because, after going through treatment, you kind of have that expectation and that expectation that things will kind of go back to normal. You've completed treatment, and that fatigue shouldn't be something that should be part of that kind of long-term experience, but it is. So, Lisa, with that, as a provider, how did you use the fatigue score with your patients?
So, sadly, I didn't really use the score, and I will be completely transparent. So if there are patients on this panel or providers, I would highly encourage to bring the score up. The way I would treat fatigue is that I would try to set realistic expectations with my patients. That the fact that it's possible that it would not go away, similar to any other sort of adverse side effect like neuropathy, things like that. Like it's possible it's not going to go away, and that's sort of how I would address it. In my specialty, 50% of my patients were still fatigued 6 months later after completion of treatment, and then 49%, which is basically the same, were fatigued well beyond 1 year. And that's based on the latest research. So just setting kind of realistic expectations with my patients. It's very difficult as a provider. Again, I'm going to be transparent because it's so individualized, and the treatment availability at this moment, or for me back last year, even not long ago, was sort of, referrals to everywhere else, referrals to exercise, referrals to mental care, referrals to mindfulness, referrals to yoga, etc. So I think it's a difficult thing to approach for both the patient and provider. And I always tell my patients, or with my family, we're all on a healthcare team, but you're the number one healthcare advocate. So I think just bringing it up and bringing up the fatigue score is super important going forward. And I just want to answer, there's a question about not receiving any treatment, but still feeling the fatigue. Exactly. I feel like as soon as you hear those words, you have cancer, I have cancer, I think as we'll go on, we'll see the vicious circle, but it just encompasses exhaustion. So, and it's real.
Absolutely. No, and one thing just to highlight about the fatigue score, because, it's so common in terms of describing pain, and especially for those who want others to really understand, being able to at least give that score, it really helps everyone understand a little bit. Again, they're not going to fully understand what it's like to be in your shoes, but being able to say, today's an 8 out of 10 can help everyone better understand kind of how you're feeling and how you are progressing day in and day out. And to Lisa's point, talking about it, whether that's with your family or with providers, is especially important, because being silent isn't going to help it, address the problem. And we had just discussed it, but one point I just want to make is the prevalence of cancer-related fatigue, because we hear from so many individuals who feel that it's just them who may be experiencing it. And the reality is it's millions of individuals, and not just here in the US, but all across the world, are experiencing fatigue. So the one point I want to make sure everyone knows is that you're not alone in going through this, and speaking out and asking for help, because there is help available. There are resources. So knowing that you're not alone, and that there's many individuals that all around the world that are going through this exact same situation, and something that we see day in and day out, no matter what country you're from or what stage you are in. You very well may have someone right down the street who's in your exact same shoes, dealing with cancer-related fatigue. Now, I want to switch to the slide that we have been referencing quite a bit today, and that is the vicious circle. And this ties in a little bit with the question we had around just even getting initial tiredness with a diagnosis. There are so many factors to fatigue. It is not just one thing that causes it, but it is so many multiple, it's a multifactorial issue. And that's why, as we've been saying, there isn't just a kind of magic pill solution, because it is so multifaceted in terms of the causes of the problem itself. So it may be a little hard to see on the slide, but we have multiple buckets. So thinking of all the various factors going through cancer treatment. So you have the side effect of medications, and these could be comorbid conditions, so not even directly related to cancer, that could be impacting your fatigue. Obviously, there's the chemotherapy and radiation. Every type of cancer and its stage is different. There could be tumor-related factors and complications, other things like anemia, and then also physical symptoms. As we mentioned, there's pain, appetite loss, and then there's the psychological, social, and behavioral pieces. And that's really where we want to focus our efforts today in talking through ways to manage through fatigue. But one point and the slide shows it fairly well here, is that when you look at all the various buckets outside of the psychological and the social, you see that they have a one-way connection to cancer-related fatigue. So by having pain, you are contributing to the cancer-related fatigue, or the chemotherapy is contributing to the cancer-related fatigue. But when you look at the psychological and the social, you see that it's really a two-way street, and that they very much there's an intercorrelation between the two. So the stress, the sleep disorder can lead to CRF, but also CRF can lead to the stress and sleep disorders or anxiety. So they very much can play a role in adding to one another. So Lisa, as a provider, when you think of the vicious circle, um, what do you normally discuss with your patients as far as the contributors and causes of cancer-related fatigue?
Mhm. So just to answer your question, and to also look at some of the questions that people have laid out, is sort of like the cause of fatigue. And as we can see, there's multiple causes of fatigue. And then all the boxes that aren't green, I as a provider can put Band-Aids on, right? I'm monitoring you, I'm watching your labs, trying to support you. And I can put Band-Aids on all these things that I can try to figure out. However, at the end of the day, we're left with the green box. And that's the most difficult box. The thing with this box is, a lot of times too, I think with cancer-related fatigue, you are told by providers sort of, what to do. This is why you're tired, so we're going to do this. This is your concern, so we're going to do this. Whereas the green box is something that really, I think, is just the kind of the self-management part. The part that you can actually can contribute, and your provider can support you through this. This is the part that's sort of left with with no Band-Aid. And that's the issue. And I think it's sort of taking back control of what everything's going on, whether your fatigue's caused by your diagnosis, active disease, whether it's treatment, stresses from work, pressures from family, etc. It's sort of this vicious cycle, and then of taking back control, like kind of like regaining those factors. And I think that's like the underlying secret of trying to treat the cancer-related fatigue.
Right. And I think one point, and you highlighted it a bit there, Lisa, is just having the discussion with your provider with regards to fatigue, so that they can evaluate what other potential factors could be resolved through, medication, or modifying medications to maybe support or help the fatigue not related to the psychological, like anemia, for example, or if you have a comorbid condition that may be contributing, that can be addressed first, and trying to make sure, to your point, that Band-Aids, if possible, can be put on those pieces, and then really focusing on the psychological and the behavioral piece.
Mm-hmm.
So
Definitely.
I want to highlight the vicious circle, because that very much is what you see here, talking about that two-way street and that correlation between them. Looks like, again, the delay, but this can help highlight, the various components that create the vicious circle. And I want to highlight this, because not everyone realizes that there is this vicious circle of emotions and events and feelings that play a role. And Lisa, I don't know if you want to kind of give an example of how these all kind of build on top of one another and can create kind of what, the spiraling effect, so to speak.
Mm-hmm. Well, it's definitely, I mean, it's just, it's sort of, it's almost like I feel it's so disheartening, because it's like you're set up for failure. You go for treatment, you get steroids keep you up at night, you can't sleep. Then while you can't sleep, you're worried about X, Y, and Z in your life. Maybe you're worried about cancer reoccurrence or whatever your worry is. And then you wake up and you're stressed, you're sleep deprived. So that's my view. You don't feel like eating, maybe. or maybe you're angry, maybe endless, as you can see, there's endless possibilities. And that's just sort of, it just keeps leading to one thing to the next. So that's what I guess we mean by the vicious circle.
Right. And for all of you, participating in the panel today, when you look at this vicious circle, what parts do you experience and kind of thinking, as part of when we talk, and we'll talk a little bit later about ways to better manage fatigue, it's all thinking about your own personal vicious circle and what areas you can really focus on to break out, because that's really what the goal is looking at what are those pieces that you could potentially hone in on and address in an effort to manage fatigue and kind of break out of this vicious circle. So next, I want to highlight, and I'm sure everyone's very interested to hear more about what are the interventions and ways to manage cancer-related fatigue, as we've all discussed at length here, the problem itself, but more importantly, how can we do something about it? And what we have on this next slide here is the National Comprehensive Cancer Network's standards of care and interventions regarding cancer-related fatigue. So you see it's kind of broken down into two buckets. We have the pharmacological side, the interventions with regards to stimulants or antidepressants and steroids. And then we have the non-pharmacologic, so the psychoeducation, the cognitive behavioral therapy, mindfulness based cognitive therapy, exercise, mind-body interventions like yoga. There's really kind of two completely different sides with regards to interventions to address cancer-related fatigue. But what many may not realize is especially on the non-pharmacological side, it's really the combination of all of those listed that can show really promising and positive results. Of course, Lisa, as a provider, what did you prescribe, so to speak, to your patients when cancer-related fatigue was brought up as an issue?
Mm-hmm. So basically, based on extensive research, there are not a lot of studies. I think there are 4 out of 19 maybe total that show that pharmacological interventions have an effect. And that's only when people are on active treatment. So, so we try to shy away from those. To be honest, I've prescribed them to patients, and I've had patients come back to me and say, "What did you do? Did you try to kill me?" Because their heart's racing, they can't sleep. It's not the best. What we have found throughout research and over time is that, as you had already said, that these non-pharmacological interventions are what works. Of course, it's difficult because everybody's completely individualized. So, someone might do good with a recipe of 10% education, 40% mindfulness, and, whatever, 50% yoga. And it's hard and it takes time, and it's just a lot of work for the patient to figure out what works best for them. But we know through research, and I know through my patients, when you're able to find that niche, that recipe, so to speak, of what works for you, it's really significantly helpful.
Absolutely. And I want to highlight too, depending on where you're located, and obviously we have the wonderful support of the Triage Cancer organization, but a lot of hospitals have their own supportive care centers that offer a lot of these resources, the non-pharmacologic, and then also other cancer organizations in every individual's community that offers a variety of different programs. I know, like for instance, the YMCA and other, I would say more local programs can be available. But one, I would say kind of comprehensive turnkey option we wanted to share with you all today, and that's the entire program that was developed by the Tired of Cancer team a few years ago. It's very much based on the standards of care that we just shared with the NCCN. And it was developed by our founder, Dr. Bram Kuiper, and other patients and experts in the field of psycho-oncology, really to uh, just create a very comprehensive program where individuals can really pick and choose what matters to them with regards to cancer-related fatigue. And I'll jump here. So that you can kind of tailor your own program to yourself based on what you may be specifically dealing with in terms of fatigue. But I think especially in this time of COVID, one of the important points we've been trying to bring across is just given not every individual is going to want to go in to a physical hospital or doctor's visit if they don't have to. Having a digital support tool can be especially valuable during this 2020 year, and hopefully see that there is additional support. Obviously, as we're all talking here online, that there's a lot being made available no matter where you're located. But to jump in a little bit about the program, I just wanted to kind of share the pieces of quote unquote the entire puzzle that really highlight the need for education with regards to cancer-related fatigue. So addressing the areas of anxiety or fear of reoccurrence or sleep or nutrition. Those are all pieces that are found in our kind of educational quadrant, as well as having physical exercises that can be done tailored obviously to every individual's kind of comfort level. As we keep saying it, with every person dealing with their own, treatment plan and their own kind of varying level of fatigue, and every day is different. That's where the program is very much suited to do what you feel up to and take it kind of one step at a time and do a little bit where you can, because we understand that you're already tired, and sitting on a phone isn't maybe the activity that you want to do, but definitely want to highlight the physical activities as well as the mindfulness based activities that can be provided. So picking and choosing what an individual may feel up to, so you can kind of take a step back and incorporate those elements into your daily life. Lisa, anything to add about the program?
No, just like viewing the questions. And again, like I think the program, the reason why we're presenting this to you all today, especially in the time of COVID, is that this does create a safe place for all those interventions. And it is self-management, so you have to choose to do it on your own time or choose not to. But it's a safe place where you're able to at least have the access to achieve these things in the safety of your own home.
Absolutely. And I'm seeing a lot of the questions come in, and I'm happy to address those now. But yes, completely reiterate, and I apologize. I think my little one has escaped. But
yeah. So Amy, I'll let you go. So I'll take over for him here. So here's the cool thing so obviously with the app, there's exercises to be offered. So patient education, like we discussed, mindfulness, physical activities, positive reinforcements, etc. But what I found absolutely fascinating when I first moved to the Netherlands and I found tired of cancer was this concept of the vase of energy. So yes, throughout the app, we measure energy. And to me, even as a provider, as a family member, caregiver, to me, it was very black and white, energy in and energy out. And what this vase of energy here is, it brings the notion of the leak. And what's a leak? Now, I've never experienced cancer in my own personal right. So for me, I'm going to give you a very kind of blanket excuse for me. So for me, I moved to the Netherlands. I gave up my career as a nurse practitioner. I knew I had to learn the language to be able to provide patient care in the hospital again. etc. So for me, that's my leak. So every day I go about my life, I go to work, I do all the things, that I want to do, I'm supposed to do, etc. I put energy into my vase, and then I know what I try to understand or try to know what takes energy out. However, what I don't realize when I go to bed at night is the drain of really not knowing the language, of not being in the hospital and being comfortable and being in the career that I chose, not knowing my way around, maybe taking an extra tram or cycling way farther than I am used to when I could have just walked, for example. And those are leaks in life. And I think that is super valuable with this, is just being able to identify and really learn yourself, if that makes any sense, and about what your leaks are and what's going to drain your energy, and also not beat yourself up at the end of the day, and say, you know what, I might be a little extra tired because of A, B, and C, because I had to try harder than, say, the average person to get through my day. And I think that's what the vase of energy does.
Absolutely. Thanks for bearing with me, everyone. I apologize again. Time of COVID, working from home.
My baby barked, so.
Since I'm just jumping back in, I'm not sure, Lisa, if you addressed the question regarding cost of the program. And I want to be fully transparent. As part of working with the Triage cancer team, we want to make sure everyone who needs support for fatigue can get it. So a little bit about Tired of Cancer is we're a social enterprise. So we're not this, commercial profit-driven company. So we're working with cancer organizations here in the US and abroad to provide Untire at no cost to patients that need it. And we're also trying to engage hospitals and cancer centers throughout the US to make it part of their care plan with patients. And obviously, in a perfect world, this would be something that could be reimbursed with your health insurance. And that is what our long-term goal and plan is. So there is no cost for Entire. We believe that this is something that should be paid for by insurance. It's something we're working on. So for the time being, it is being accessed via an access code. So I know you can reach out. I think, Madison, you guys have a set of access codes that we could be providing any individual who would be interested, or you're welcome to, I think, email me and I could help do that. But we have set aside a number of codes for the Triage Cancer team to provide. I hope that answers your question. And if it doesn't, please feel free to add more in the chat box. But given we have a few minutes left, I want to make sure we open it up for questions. But just to highlight again, tips for better energy management, the validation that CRF is something and you're not alone is really a first step, and something we've heard from a lot of individuals, of just knowing that it is something, that this isn't this isn't made up in your mind. It truly is something. It has a name. Prioritize and planning, and this is with regards to energy expenditure. I know it's hard to really navigate kind of this new world, especially post-treatment or during treatment, but prioritize and planning goes a long way with regards to how you want to spend your energy, and really breaking down tasks into smaller parts or dividing out those tasks to others to help support you. Taking breaks and adding energy is also very much something that we always like to highlight, especially those of you, working in a variety of different settings. Small breaks, even just taking a minute or two to do a mindfulness exercise, or we read a tip, can add energy. Little things, again, step by step. And then focusing on ways to fix those leaks as you identify them, and then be able to address them. And then lastly, talking about it. So, you're not in this alone. And telling your friends and family and your doctor, or even your boss helping those around you better understand it also can be very supportive for you in kind of taking those steps to better manage it. Lisa, anything to add?
Yeah, no, I know that was great, but I'm looking at the chat boxes and just like the difference between a leak and then sort of like the out energy. And I think it's just identifying your leaks, like, so the things you can't change, like, so for just to go back to my example, because it's the thing I know, is that, like, yes, can I learn Dutch? Yes. Is it going to take me time? Yes. Am I exhausted at the end of the day? Even though everybody's nice to me and they're trying to speak English, it's just exhausting trying to read signs, etc. It's something I can't really control, but it's something I can, by identifying it, it's something like it can take my own self-management and work towards. Whereas an energy drain might be something as simple as you have a really good day, so you pour a lot in your base, and then maybe something happens during that day, a conflict, or you get a parking ticket or whatever. That's not something that happens every day, but that would be like a daily drain in your energy, right? Because no one likes getting a parking ticket. But so that's just, so for example, to try to differentiate the leak and then like sort of the out energy. But the leak is something like, once you identify it, you realize, oh my gosh, like this is really draining me. And it might take time, but once you identify it, it's something that you can work towards fixing, if that makes sense.
Yeah. I wanted to make sure, I know we have 5 minutes left, that we addressed any other questions. We had a couple extra questions that we typically hear when we talk to patients and providers. So we had kind of added those in case there weren't any questions, but happy to take any from the audience. Happy to, as I'm seeing all the chats, very much happy to provide access to the program. It sounds like there's a lot of you that could find some support in it, and that's great to hear. One question I feel like we get a lot about, and it's a topic that we're trying to do more about, and that is working with cancer, because everyone tries to kind of quote unquote stay normal, and obviously keeping our work performance and attendance while going through treatment or post treatment is incredibly important. So a lot of questions are always asked of, how do you talk about this at work in a productive way? And fatigue is actually one of the biggest issues and barriers individuals face reintegrating back into work. So it's, again, you're not alone, and it's an incredibly common issue. We've talked about it multiple times already, but talking about it, really being able to discuss it with your supervisor or HR team, this is something that is something you shouldn't be ignoring, and that typically businesses should be trying to accommodate you as an individual in putting together the right kind of flexibility in order to manage through this. And also remember that there are going to be days that are harder or easier than others. And it's always speaking up and sharing about your experiences. We know multiple individuals have shared even just going for a walk in the middle of the day or taking a break can really help restore some of that energy, especially if you've been sitting at a desk all day. Those kind of activities really can add some additional benefit. Lisa, anything that you would want to add?
Yeah, no, I just saw one of the questions, and it was just sort of like, why not just take a nap? And like, definitely take a nap, and that totally works for some people. However, to be honest, as a provider, and I'm so happy you asked this question, because this was the question that would trigger me and that I would trigger to ask patients. So when I ask patients, if you're tired and if you take a nap and you still feel unwell, I want you to call me. And that was always a main trigger. And I feel like that's what cancer related fatigue is. It's out of the norm. Like if you're tired and you take a nap and you feel unwell, it's not okay, and you need to talk to your provider.
Absolutely. Yes. Lisa, very much want to highlight that point too, in that you have a care team to support you. And I know we're getting a lot of comments too. There's a lot of individuals that are there to support you. And so raising this question or issue with your care team, together, they can really help point you in the direction of resources and things that very well may be available to you locally that you could be able to have access to. And of course, we are happy to be able to provide access to the entire app so you can have the program at your fingertips on the phone. I know a lot of individuals are saying, I might be an hour from the hospital. I don't have the time or the energy to be able to have those in-person visits. I mean, that's very much why programs like this have been made available. And obviously, cancer organizations like Triage and I know Gilda's Club are all offering a lot of online support resources for a variety of different topics like nutrition, pain management. There's a lot of local resources that can also address specifics. And it looks like, Madison, you just shared in the chat, and feel free to jump in, that if anyone does want to get access to the program, to email you directly, and you can be providing those access codes. And I've also shared my email. You, of course, are welcome to reach out to me as well. But it really looks like we've had a lot of great feedback. So we certainly appreciate everyone's input and being able to share this with all of you today.
And just one of the other comments, just a thank you to all of the social workers. One of the oncology social workers just mentioned, that's the thing, like your team execute or take advantage or tap into or ask or talk to your entire team, social work team, your nurses, your nurse practitioners, and your oncologists, because we're all trained to try to help you.
Absolutely. And I'm seeing more questions come in with regards to cost. There is no cost for the app. I know a lot of people always expect that. It's one thing when we started, we know going through cancer treatment and subsequent treatments are very expensive, especially in the US where, healthcare costs keep rising. Our team does not want to add to that burden. And like I said, our goal is that this becomes something that hospitals and health insurance companies will provide. But until that happens, we're allowing everyone to have access to the app through partnerships like with the Triage Cancer team. So that's where we're providing the access codes at no cost. So just want to reiterate that again, that our mission isn't to make a bunch of money. It's really to support individuals and everyone that's going through this.
All right, thank you so much, Amy and Lisa, for that great information. Like I said in the chat, Triage Cancer does have a limited number of entire access codes, and you can correct me if I'm wrong, but I believe they are for one use only, one per patient.
Yes. So if you go down and download the app, it'll prompt you as you set up an account to just submit the 8-digit access code. So everyone has a unique code that they would have to put in.
But not one use, just one per patient, just to clarify.
Mm-hmm.
Yeah, like it's not like, yeah. Okay.
Awesome. So you can email me at mm@triagecancer.org if you would like access to one of our access codes. But I want to thank you all for being here with us. I know that we are a little over time, so I just want to briefly go over the continuing education credit portion again for you all. So in order to receive continuing education credit, you must have registered online for today's session. People who are listening in on someone else's computer are not eligible for credit. You must have attended the entire webinar. No partial credit will be awarded, and anyone watching a recording of the webinar will also not be eligible for credit. Within 1 week of this webinar, complete an evaluation and post-test. You must receive a passing grade on the post-test to be eligible for contact hours, and you will be redirected to the survey once the webinar ends, and you will also receive an email tomorrow with the evaluation link and the post-test link. Please note that on the evaluation, it asks for your name and email address, And you must include these so that we can certify that you completed the evaluation. That email is the address we will use to mail the certificates, and we will be sending out certificates within 4 weeks. For other types of healthcare professionals, we are more than happy to provide a general certificate of attendance. Just make sure to indicate that request on your evaluation. And if you have any questions or experience any problems, email us at info@triagecancer.org. And I want to thank you all again for joining us today, and thank Amy and Lisa for being here to present this on such an important topic. I know many of you have questions or continue to have questions, so feel free to reach out to us, and I can always forward your questions along to Amy and Lisa. We hope that you found this presentation useful and will continue to stay connected with Triage Cancer. Thank you.